Indonesia has been overwhelmed by a second wave of COVID-19 infections since June 2021. The country is now the epicenter of the pandemic in Asia, and the crisis is being fueled by the highly transmissible Delta variant.
Walaupun kena COVID ya, jadi takut sendiri.
The situation right now in Indonesia is particularly worrying. If the vaccines were available earlier, Indonesia will not see a high fatality rate.
Over in the Philippines, the Delta variant is now a looming threat. Worryingly, the country is facing the same lack of vaccines.
We still have the threat of the Delta variant, and while we haven't fully vaccinated our people yet, we have to manage the pandemic without the vaccine so far.
Naiinip na po kasi dumadami na po kasi yung mga nagkakasakit. Sana po dumating na yung bakuna para sa aming tricycle driver.
Across the globe, vaccine distribution has been hugely unequal.
75% of the world's vaccine now is being accessed by developed countries. And countries in Asia have 5 to 10% access.
This inequitable access to vaccines has led to devastating consequences.
It has created an opportunity for the virus to freely transmit in countries where there is lower coverage.
What has led to this situation? What are both Indonesia and the Philippines doing to face down the crisis? Indonesia has become the epicenter of the COVID-19 pandemic in Asia, overtaking India since mid-July 2021.
Every day we receive bad news that we have lost our friends, families, close relatives. Many more people heavily suffered from this second wave. So if the vaccines were available earlier, Indonesia will not see a high fatality rate, even though right now the country is fighting against the second wave of the pandemic.
Many would have agreed, even before the second wave hit. Anastasia Retno Pujastuti trains caregivers and babysitters in Jakarta. Until early this year, the single mother lived with her 12-year-old twins and her aged parents in Bekasi, 30 minutes away from central Jakarta. Her neighborhood had not been spared by the coronavirus, but Anastasia and her family took all precautions. Then, in February,
Ibu saya pergilah ke pasar dan kayaknya sih ya, saya merasanya ibu saya mulai kenanya dari situ, dari dia pergi ke pasar. Jadi virusnya itu bereaksi kali ya. Nah, udah akhirnya ibu saya mulailah meriang-meriang. Udah akhirnya bapak juga ikut meriang-meriang gitu.
Anastasia's parents got so ill they had to be hospitalized. Due to the lack of beds at the intensive care units, they ended up in separate hospitals where they tested positive for COVID-19. 2 weeks later, they were put on ventilators and the condition deteriorated.
Benar 16 pagi, jam 6 pagi saya dapat telepon dulu dari tempat bapak saya. Terus ada dokter yang keluar, dokternya bilang iya udah nggak ada. 16 Maret jam 7.05 pagi. Jam 6 sore itu dapat kabar ibu lagi ngedrop. Bener jam 7:05 malam ibu saya meninggal. Sedihnya itu ngelihat bapak dan ibu nggak bisa ditemenin.
But even as she was burying her parents, Anastasia herself was falling sick.
Tapi kemudian tanggal 15 itu udah deh saya tes swab gitu ya, tes PCR. Udah positif. Maksudnya setelah penguburan selesai semua, saya masuk rumah sakit. Di rumah sakit saya 10 hari.
When Anastasia's ordeal first started in February, Indonesia had inoculated less than 1% of its population of more than 276 million people. In comparison, the US had vaccinated 15% of its 330 million people by that time. But for people like Anastasia and her parents, there just hadn't been enough vaccine doses in Indonesia.
2021 itu di awal-awal ya, di awal-awal tuh yang ada Pak Jokowi disuntik tuh di TV gitu ya, kelihatan ya, terus udah mulai gitu ya. Terus tapi karena saya tinggalnya di Bekasi ya, kayaknya belum nyampe gaungnya tuh belum nyampe Bekasi gitu.
Nah, tantangan terutama dalam hal distribusi adalah pertama jumlah vaksin yang tentunya tidak tersedia secara penuh. Artinya kita harus betul-betul membagi dan memprioritaskan. Kedua adalah tentunya perjalanan pengiriman distribusi ke daerah-daerah yang terpencil, terdalam, terluar pasti akan membutuhkan waktu. Apalagi jumlah vaksinnya itu hanya sedikit-sedikit datangnya. Jadi kita harus betul-betul memanage bagaimana distribusi itu bisa berjalan dengan baik.
The slow rollout was further held back when the second wave hit, with the Delta variant driving daily cases to more than 50,000 at one point. Movement restrictions had to be implemented.
Jadi memang situasi saat ini adalah jumlah kasus yang lebih tinggi ya dibandingkan dengan kita. Tentunya kita berusaha untuk mengendalikan laju penularan kasus ini, tetapi kita juga tetap melaksanakan vaksinasi ya. Nanti kalau sudah kasusnya lebih terkontrol, kita akan mengakselerasi lagi vaksinasi tadi sesuai dengan target, di mana di bulan Agustus nanti 2 juta dosis per hari itu sudah harus kita berikan untuk pelaksanaan vaksinasi.
Unfortunately, low vaccination numbers are not unique to Indonesia. Poorer countries around the world have all faced a severe lack of vaccines. The imbalance has its roots in how vaccine development started. Rich countries like the US, the UK, and even Singapore could invest billions in the pharmaceutical companies working on vaccines, supercharging the process. But that also meant that they were entitled to the vaccines for their own populations ahead of other nations.
Many developing countries around the world do not have the same capability, do not have the same capacity to provide such funds. That's why they also do not have equal access to vaccines. Vaccine negotiations was not an easy process, and not so many vaccine manufacturers from developed world provided favorable response to Indonesia. And the vaccines manufacturers prioritize those who support them, so the impact is poorer countries will not be prioritized in vaccine supply.
In response to this problematic vaccine nationalism, the Global Alliance for Vaccines and Immunization, the Coalition for Epidemic Preparedness Innovations, and the World Health Organization set up the COVID-19 Vaccines Global Access, also known as COVAX. It aims to coordinate international resources to enable low to middle-income countries more equitable access to COVID-19 tests, therapies, and vaccines. The effort is funded by rich countries, together with private sector and philanthropic contributions. A total of 92 countries are eligible to receive COVID-19 vaccines through the COVAX mechanism, including Singapore. But as Singapore has secured sufficient doses for its population, it has announced that it will donate its share of COVAX vaccines to other countries.
If there is a very strong vaccine nationalism without taking care of other countries, the main goal of no one is safe until everyone is safe will not be achieved. The main issue of the new variant, especially Delta, because they transmit very frequently, so the disease could spread more faster. So if people could not be protected by vaccine, so the problem will become bigger in the country or area without vaccine covered. But at the end of the day, We are an interconnected world. We cannot separate one country to the other. So it has to be everybody here.
At 675 million people, Southeast Asia is 1% of the world's population. But its average GDP per capita of around $13,000 is far below other parts of the world like US at 68,000 and Europe at $41,000. The two most populous nations, Indonesia and the Philippines, have a combined number of over 5 million COVID-19 infections. They have fully vaccinated less than 10% of their people. The impact of vaccine nationalism has also been significant in the Philippines, with the Delta variant an impending threat. To date, just over 7% of its 108 million people are fully vaccinated.
So that is the injustice. You know, some countries have a lot and they store a lot, and yet some of their citizens kind of the luxury of not wanting to. But in the Philippines, you see a reversal of that. Many people now would like to be vaccinated, and yet we don't have that much supply.
As an economic frontliner, Nawin Apon is one of those desperate for a COVID-19 vaccine. He's a tricycle driver in Malolos, an hour's drive from Metro Manila.
Good morning, ma'am. Saan po? Natatakot po ako na mahawaan po ng COVID dahil po sa dami pong nakakasalamuha akong tao. Kahit takot po ako mamasada, itutuloy-tuloy ko pa rin po ang aking paghahanap buhay para sa aking pamilya. Baka pag-uwi ko po, may dala po akong virus sa aking pamilya, mahawaan pa po ang aking pamilya.
The country's lack of access to vaccines had been made worse by bureaucracy.
Well, the Philippines initially hesitant to negotiate purchase agreements with pharmaceutical companies. First, it was avoiding to sign non-disclosure agreements with these companies. Secondly, it was avoiding to protect pharmaceutical companies for any liabilities. And thirdly, there are existing Philippine laws that prevent the government from prepayment of orders. In the end, the Philippines complied with all these conditions. However, it was too late for the Duterte administration when it finally made up its mind. So the Philippines was relegated at the bottom of the priority list of pharmaceutical companies, and therefore other countries got the available slots for early delivery of the vaccines.
In Manila, tricycle drivers are starting to get their vaccines. But the city of Malolos is still only giving out doses to health workers, senior citizens, and patients with comorbidities.
Kung maaga po, sana dumating yung bakuna sa Pilipinas. Tingin ko po, unang-una po, nagpa-schedule po ako ng bakuna kaagad. Sa ibang lugar po, nagsisimula na yung mga tricycle driver na bakunahan. Nainggit po ako. Naiinip na po kasi dumadami na po kasi yung mga nagkakasakit. At sana po, dumating na yung bakuna para sa aming tricycle driver.
Nawin and others like him have good reason to worry. Besides the risk of infection, there's also the risk of long COVID. In Indonesia, Anastasia is still not fully recovered.
Sampai sekarang masih rada nggak enak juga kalau misalnya pagi-pagi ya, bangun pagi itu tenggorokan masih rasa kering, terus kemudian badan nggak enak. Itu saya ngerasa kalau saya mendapatkan vaksin itu lebih dulu sebelum kejadian. Mungkin kalau saya dapat vaksinnya barengan Pak Jokowi gitu ya, mungkin saya walaupun saya pegang bapak sama ibu, tidak yang sampai sekarang masih dirasain gitu, tidak yang long COVID gitu ya.
Like many lower to middle income countries, the Philippines did not have the public funds to pay for vaccines in the early development stages. During President Duterte's State of the Nation address in July 2020, he asked China for help.
4 days ago, I made a plea to President Xi Jinping that if they have the vaccine, can they allow us to be one of the first so that we can normalize as fast as possible.
We were talking to diplomatic routes so that we can actually connect with the government so that they can order their vaccine manufacturers to supply us the necessary vaccines that our country needed at the earliest possible time. First delivery that was scheduled to us was going to be Pfizer and AstraZeneca, but eventually got delayed. Sinovac so far has actually been delivering on the dates they scheduled. We also asked for an increase in delivery, but they acceded to that and they're delivering more.
Since the start of his administration, Duterte has relied heavily on China. When the Philippines faced issues or problems, for example, natural disasters, its war on drugs, and the Marawi siege, it really relied on China for help. So it is no wonder that the Duterte administration is asking for China for its vaccines. China donated over 1 million doses of vaccines to the Philippines. And China also pledged to make the Philippines on top of its priority list of its shipments abroad for their vaccines.
Indonesia also turned to China in August last year. But early in 2020, the government was already trying to secure deals with the pharmaceutical companies in the West. One was with AstraZeneca for 100 million doses of its vaccine. The British-Swedish company vowed to sell the vaccine at cost, making it cheaper than other Western-made vaccines.
Aside from price, we have to also take into considerations the logistic issue. The distributions of Pfizer and Moderna vaccine must be supported by some specific good infrastructure that not so many regions in Indonesia can provide. I think Indonesia was taking a chance to procure AstraZeneca vaccines. At that time, Indonesia was also uncertain about the efficacy of the vaccine. Indonesia was not in the position to choose. Indonesia was more in the situations that we have to make any deals as soon as possible.
But Indonesia does own one of the world's oldest vaccine production company, PT Bio Farma. Bio Farma had collaborated with Sinovac on the development of other vaccines before. And so in December 2020, the two state-owned enterprises launched a human trial of Sinovac's vaccine in West Java, involving more than 1,600 patients.
Yes, Sinovac engaged Biopharma and Pajero University in Bandung, West Java to conduct a stage 3 clinical trial in West Java. And at the time, COVID was prevalent in West Java, so it made for the appropriate conditions for a successful clinical trial.
Because at that time, China is already under control. Indonesia has high prevalence of COVID-19. That's for the main reason. The second, this vaccine will be also given to the Indonesian. So it will also raise more confidence if the result come from within the country. When they released the result, they found the 65% of the efficacy of the Sinovac.
Jadi mengapa kemudian Sinovac ini yang menjadi pilihan kita yang terutama adalah karena pertama Sinovac itu yang pertama kali berkomitmen untuk mengirimkan vaksin itu pada bulan Desember. Yang artinya kita di Januari 2021 Indonesia sudah bisa memulai vaksinasi. Sementara produsen vaksin lainnya itu baru akan dapat mengirimkan itu pada semester kedua 2021. Yang kedua adalah Sinovac yang sudah juga memberikan komitmen untuk bisa mensuplai kebutuhan vaksin di Indonesia itu sebanyak 125 juta dosis ya. Sementara produsen vaksin lainnya itu masih hanya mampu menyediakan sekitar 50 juta dosis dan itu pun datang pada semester kedua. Dan yang ketiga adalah Sinovac bekerja sama dengan Bio Farma melakukan transfer teknologi. Jadi Sinovac mengirimkan dalam bentuk bulk, kemudian Bio Farma menjadikan vaksin dalam bentuk bulk tersebut menjadi vaksin jadi.
China was then already the largest investor and trading partner for both Indonesia and the Philippines. Turning to the Asian superpower for vaccines created controversy in both countries.
The Indonesian government's claim that one of the dimensions of Sinovac Biopharma vaccine cooperations is transfer technology. It's not that really significant because we only receive vaccine bulk from China and then Indonesia just put it in a bottle. And Indonesia make the vaccine bulk into finished product. We haven't seen any direct pressure given by the Chinese sides for the Indonesian side. So the indirect pressures could be manifested into a feeling of indebtedness that somehow we need to pay back. During the pandemic, Indonesia had already organized at least 3 or 4 bilateral meetings. Our foreign minister visited China and even State Councilor Wang Yi also visited Indonesia. Yeah? So we can see an intensification of bilateral interactions.
Duterte administration's reliance on Chinese vaccines would make the Philippines more vulnerable to Chinese pressures on issues in the bilateral relations. This might make the Philippines weaker in its negotiations with China in matters related to West Philippine Sea. The Philippines will get more dependent on China. This is not a good situation for the Philippines, but this is the reality because we also need China to help our countrymen to get vaccinated through their vaccines.
But despite getting the vaccines from China, neither Indonesia nor Philippines had enough vaccine doses for its population. So, both turned to their private sectors for help. For the Philippines, it was a public-private effort.
Group of Go Negosyo, Ayala, and SM, and led by Secretary Joey Concepcion, actually gambled because they signed an agreement and paid for the deliveries of AstraZeneca for 2.5 million doses initially, even before the EUA, the Emergency Use Authorization by our Philippine FDA, was given. The Philippine government honored that particular arrangement. The tripartite agreement was the first in the world. So after the first 2.5 million, there were subsequent consolidation of companies that want to procure vaccines for their employees and the dependents of their employees. So this is public and private sector helping each other to achieve vaccination of the population faster.
Flexible, innovative thinking there because the government is looking at how they can use private sector financing to increase the number of people protected.
Innovative, perhaps, but it has its limitations.
The general public might be feeling left out because the people who work in multinational companies or large corporations have a better chance at getting vaccinated earlier than other workers, Filipino workers, especially those working in the informal sector and small, medium enterprises. So, unfortunately, they have limited chances of getting vaccinated.
And it's the vast majority of citizens who will miss out. Citizens like Joy Pultang. Joy, like many others, work in the informal sector. The mother of 2 supports her family by reselling beauty products for $2 to $10 per day in her neighborhood.
Sana yung mga katulad ko na sa bahay walang regular na trabaho, ay mabakunahan din sana agad. Kasi hindi rin maiwasan na lumalabas din kami. Siyempre gusto rin namin ng protection. Dismayado rin talaga kasi napakabagal nung vaccine. Gusto man ng tao, kaso yung gobyerno parang ang bagal pa rin kumilos. Pag lumalabas ako at nakakausap ko yung mga tao, lagi ko talaga iniisip na baka nahawa na naman ako. Pero wala na talagang choice kasi ganun talaga.
Joy and her family have already had their brush with COVID-19, and having no access to vaccines is a cause of great anxiety.
Ang naging epekto ng COVID sa pamilya ko, simula nung nagkasakit yung biyanan ko, sinabtest din yung pamilya namin lahat kami dito sa bahay. Tapos nalaman ko nga rin na meron din ako.
Joy's mother-in-law was admitted to the hospital and died 8 days later. Joy didn't get to say goodbye as she was under quarantine.
Kaya nahirapan ako din tanggapin yung nangyari kasi nanay na talaga turing ko sa kanya. Ang hirap, para ako nawala ng nanay.
Despite the pitfalls associated with turning to the private sector, Indonesia took that route too. The government announced in February this year that they were drafting regulations for a private vaccination scheme named Gotong Royong.
Melaksanakan vaksinasi gotong royong ini.
Jadi vaksinasi gotong royong adalah bermula pada inisiatif dari swasta dan pengusaha untuk membantu pemerintah mempercepat proses vaksinasi dan memperbanyak segera orang yang mendapatkan vaksin. Jadi baik program vaksinasi gotong royong maupun program vaksinasi pemerintah itu kedua-duanya baik karyawatinya itu tidak boleh dikenakan pembiayaan apapun.
Ostensibly, the program is designed to enable the employees of companies to obtain vaccines as a way to restart economic growth. But in fact, the beneficiaries also include the directors and executives. So there's a lot of self-interest involved. It's unseemly because you have a situation where more well-connected individuals have basically preferential access to vaccination vis-a-vis regular citizens who are not corporate employees.
The government, since the beginning of pandemic, focused on economy first. Also, they want to recover their economic sector. And that's why they do under this scheme, they want to vaccinate their workers. This scheme against the public health strategy.
With the pandemic, wrong moves can cost lives. What else went wrong in Indonesia and the Philippines? Bringing vaccines into the country is one thing. Getting the vaccines into the population is another. After inoculating its health and essential workers, Indonesia had planned to target the younger working population before the elderly.
I do not see any problem with that logic. Indonesia's working populations right now is around 133 million, so it's quite big. So it's very important for the government to ensure that this large proportion of the people receive vaccinations to support the economic recovery.
But it was a controversial decision, going against WHO recommendations.
There is a document from the Scientific Advisory Group of Experts on Epidemiology back in November, and it details several options that countries can take when they distribute the vaccines. They go to the length of mapping out who are the vulnerable population, who must get first, what other options can you exercise. I think that approach should have been taken rather than the approach of the productive population must be first. I think rather than going to directly to the healthy population first, the equity principle must be upheld, and you go to the ones who need the help most.
And plans, especially controversial ones, needed to be communicated well.
Indonesia's population is very heterogeneous, and those who live in cities, those with different levels of education, those with different exposures to science facts, those with different exposures to policy making, and then those who live in the rural areas. I think the first principle is to understand that we are actually not communicating to singular group, and then thereby not only in languages but also in approaches, in materials, whether you go through radio or through social media or through television or to flyers. I think those types of continuous approach in different angles of communication needs to be strengthened.
In Bekasi, Anastasia was eager to get the vaccine.
Tadinya tuh nggak tersebar informasi itu, nggak terlalu tersebar. Dari bulan Mei saya udah nanyain, belum tahu lagi nih kapan lagi. Masih sebegini ya kesadaran masyarakat ya, kita mencoba untuk menjalankan apa yang saya bisa.
In the Philippines, communication is a challenge too, as each city has its own vaccine regulations. Joy encountered difficulties when trying to book a vaccination appointment in her city, Malabon.
Yung nagsimulang lumabas yung vaccine, tapos may mga lumabas sa mga apps sa cellphone na mag-register ka nga para kung sakali dumating yung vaccine, tawag-tawag na rin ng pangalan. Nag-register nga ako sa apps, tapos dito sa Malabon. Tapos ngayon daw, nagbago naman pala neto pala, hindi na pala ganun yung process ng barangay namin. Kailangan pa palang pumunta dun sa barangay, magpalista, at saka kailangan pa palang patawag muna. Hintayin nyo muna yung tawag.
In some areas, we have horror stories of people waiting for 8 hours just to get complete an appointment, and then after that, you have to wait for months to be called. But in my case, I did not experience that. In my case, it's very easy, seamless. So I think it depends, I think, on the local government unit. But the fact that it is erratic means it's uneven, meaning that it's still a problem because it's not standardized. There is still pockets of inefficiency and then pockets of efficiency, which is not good.
My thinking is that the national government gave too much leeway to the local government units, or probably put the burden on the city government to inoculate their citizens. And I think that the slow progress of the immunization program shows that there's some miscommunication, or there's some things that are not sorted out when there's a vaccine rollout in a city and there's no organization between the national and the local government.
Communication and organization issues aside, both Indonesia and the Philippines were still in dire need of vaccine doses early this year. Both governments had registered to get vaccines for 20% of their populations from COVAX. 54.1 million people in Indonesia and 21.6 million in the Philippines. But COVAX itself had problems getting the doses it needed.
One of the key challenges of COVAX to getting the commitment and pledges or concrete donations and support from countries, because it's basically the whole world with needs of vaccination, but not enough supplies.
You're competing for the same pool of vaccines that can be produced by the same limited number of manufacturers. It's been challenging for the companies that are producing because these are biological processes that cannot be scaled up very quickly. You need to ensure that the products are safe, they are efficacious, and they follow good manufacturing practices. What that did was that it created a supply bottleneck for the COVAX deliveries.
And this year, a bottleneck grew into a serious problem. The Serum Institute of India, the world's largest vaccine manufacturer, had pledged 200 million doses of AstraZeneca to COVAX. But when India faced a devastating wave of COVID-19 infections in April, largely due to the new, highly transmissible Delta variant, its officials restricted the export of vaccines in order to protect its own population. This meant that the Philippines, for one, had to lower its vaccination targets from 70 to 50% this year. And Indonesia too experienced a significant drop in vaccine supply.
Di bulan April yang harusnya kita memiliki stok vaksin yang beredar itu sekitar 15 juta. Tetapi kemudian ternyata karena tidak ada pengiriman lebih lanjut dari COVAX, di mana pengiriman pertama itu kita dapatkan angkanya hanya dari komitmen sebanyak 3 juta, ternyata yang dikirimkan kepada kita hanya 1,1 juta.
And to make things worse, the Delta variant has now caused the largest spike in COVID-19 infections in the country.
The Delta variant has become a new epidemic within the pandemic. So many countries now has a new wave, new case because of this Delta variant. If we put this context in terms of vaccination, the country who has less vaccinated person or people is the country who more vulnerable due to this Delta variant.
With the COVID-19 virus continually mutating and new variants surfacing, the key to protecting everyone is still vaccines.
The emergence of variants creates added pressure to see how we can accelerate vaccine deliveries. Tomorrow we may have a variant that is even more transmissible, or maybe is capable of causing even more severe disease. And that is why we have been emphasizing that whether be it alpha, beta, or delta, yes, you need to increase your response capacities.
Belum cukup bukti yang bisa kemudian mengatakan sebuah atau satu jenis merek vaksin tertentu itu sudah tidak efektif untuk varian ini. Jadi kuncinya kembali bahwa untuk mengatasi varian dan kemudian kita harus segera melakukan vaksinasi, mengingat Indonesia itu baru 13 juta yang mendapatkan dosis secara lengkap.
But even as poorer countries like Indonesia and the Philippines race to vaccinate their populations, there's light at the end of the tunnel. In mid-2021, only 1% of people in low and middle-income countries around the world have received at least one dose of COVID-19 vaccine.
Kita berusaha keras untuk bisa pertama memastikan ketersediaan vaksin ini dengan berbagai sumber. Nah, salah satunya adalah tentunya mencoba menegosiasikan tambahan kepada Sinovac kurang lebih 50 juta dosis. Kemudian secara diplomasi kita juga meminta dukungan kepada negara-negara melalui negara-negara G20, ya, terutama pada Jepang, Amerika, Australia yang sudah berkomitmen juga untuk membantu melakukan penambahan vaksin ini.
The good news for poorer countries is that after inoculating most of their own populations, richer nations have stepped up their assistance. At the G7 summit in June, world leaders committed 870 million vaccine donations. Both Indonesia and the Philippines have also inked deals with Pfizer-BioNTech and are finally getting deliveries from August. The vaccine maker is sending 50 million doses to Indonesia, enough for around 10% of its population, and 40 million doses to the Philippines for around 20% of their people. Orders from other vaccine makers are also starting to arrive, and more is being done on other fronts too. In the Philippines, authorities have started trials on mixing vaccines.
Based on the data that we have, the efficacy is still high or maybe even higher when we mix different brands together. So sometimes we can use Sinovac, for example, and get a second dose of Moderna or Pfizer. It has been studied in other countries. What they're seeing is that it looks like it's okay. The efficacy is still high. I think it would be an acceptable strategy, especially if we have a limited number of vaccines.
On the ground, organizations like the Philippine Red Cross are supplementing the government's distribution of vaccines. They are bringing the doses to the public in special vaccine buses.
Well, the vacuna bus will go to a particular area where people are not aware of the program of the government that they can get it free. And that's where it's effective. You go right to the doorstep of the people. Local governments usually should welcome these buses because they can intensify the vaccination in their area. Because if you rely on the centers where the vaccinations of the LGU are, people will tend to line up long, which means that they can get the disease from each other, right?
The Tondo Community Initiative is also rolling up its sleeves to help residents with no internet access to book their vaccination appointments.
We know that this community, being poorest of the poor, may not have the courage to be active in demanding for their rights, to have access. We found out that even if there are vaccination registration that they cannot afford because most of them have no cell phone, they don't have internet access. So Tondo Community Initiative decided that we will focus on helping the government on the online registration. So we personally, each of the social workers goes to this community and encourage people to do online registrations.
Over in Indonesia, vaccine manufacturer Bio Farma has started talking with China about producing the Sinovac vaccine from scratch.
Jadi Bio Farma sekarang ini adalah dalam tahap produksi dari bentuk bulk menjadi vaksin jadi. Sementara kalau untuk membuat dari awal vaksin tersebut itu belum dilakukan dikarenakan memang kita fokusnya adalah bagaimana vaksin setengah jadi tadi bisa segera diproduksi menjadi vaksin jadi. Jadi itu adalah sesuatu yang ditawarkan oleh pemerintah Cina untuk keberlanjutan kerjasama ini ya.
3 school alumni associations have also come together to form Sentra Vaksinasi Servium, an independent vaccination center run by volunteers to help inoculate the community.
Tujuan kami untuk terlibat memberikan vaksin ini adalah agar program percepatan vaksinasi nasional bisa berjalan dengan lancar. Kita tidak disupport pemerintah dalam hal segi financial. Kita bisa memahami, kita dapat vaksin secara gratis itu sesuatu yang sudah diberikan pemerintah kepada kami. Nah, hal lain tentunya mengoperasikan sentra ini perlu dana. Nah, untuk itu saya jujur aja dibantu oleh berbagai alumni yang bekerja di beberapa company yang cukup besar yang membantu dari segi pendanaan. Dan dari berbagai perusahaan-perusahaan yang secara sukarela membantu kami. Kami satu hari hanya bisa memvaksin 1.000 akseptor. Pencapaian sentra vaksin Servium sampai saat ini kurang lebih mungkin sudah sekitar 38.000.
Housewife Donna Sita Arianti decided to come here for her vaccination.
Saya punya anak kecil di rumah. Nah, sekarang kan anak kecil juga lagi banyak ya Bu ya, lagi banyak. Saya senang banget malah ada sentra vaksin ini. Jadi kita nggak nunggu dari puskesmas atau gimana yang jadwalnya memang mereka punya jadwal sendiri, tapi dengan sentra ini kita bisa mandiri gitu. Pertama lebih cepat.
With vaccine supplies increasing, both Indonesia and the Philippines can afford to be slightly more optimistic.
Kita mendapatkan seperti kemarin bantuan dari Jepang, kemudian mendapatkan bantuan juga nanti dalam waktu dekat dari negara Amerika untuk Moderna, dan kita juga mendapatkan sinyal baik juga untuk mendapatkan dukungan dari Australia. Nah, jumlahnya ini masih akan terus bisa bertambah dan ini sedang dalam proses negosiasi kita secara bilateral kepada negara-negara tersebut. Setidaknya 80% dari sasaran target vaksinasi kita itu bisa sudah mendapatkan vaksin di akhir Desember 2021 dengan dosis pertama.
Goal was to vaccinate 70 million people fully vaccinated by November 28th of this year. The country's vaccination centers, we have about 3,700, I think almost 4,000 already that's vaccinating, and we're able to churn out almost 350,000 a day. And the goal is to reach our target, we should be vaccinating 500,000 a day. So our only problem now is really the supply delivery. As long as the supplies are steady and every month we get about 15 million doses, we will be able to reach our target plus or minus 1 to 2 weeks.
The supplies will come and it will be enough to supply and inoculate the whole world, perhaps sooner than we think. Because now manufacturers are ramping up their capacity, and the sooner that the supply can cover the whole population, the sooner we have a real hope that the pandemic will end. You know, the sooner the world come together to distribute vaccines equitably and make production available in different parts of the world, I think that will be our light at the end of the tunnel.